Hi, I'm Dr. Greg Hollstrom here in Largo, Florida at the Florida Center for Back and Neck Pain. And patients will frequently ask me, well, why did you become a chiropractor? And I tell them that from a very early age. I kind of knew that I wanted to go into healthcare. I had interest in the sciences. I loved doing book reports on the human body, the heart, and the brain, the circulatory system. And when we had our choice of doing a book report, that would be always something that I would navigate to. But even more importantly, as a young child, my father's a chiropractic physician, and so is my grandfather. And I have several aunts and uncles and cousins and so forth. And I'd come home from school, and I had to walk through the waiting room to get to the back portion of the office. And frequently, as I come through the waiting room, there would be a patient that was waiting in the waiting room to come back in, and they say, "Aren't you the doctor's son?" And I would say, "Yeah." I'm not sure if I was in trouble or not for something or another. Usually not the case, but. And they say, "Well, just no, that's okay. I just wanted to find out if you were the doctor's son because I wanted to tell you how much your father has helped me and what a wonderful man he is." And he is indeed a wonderful man, but chiropractors in general who do great jobs for people will frequently have great outcomes, and we produce a lot of very happy people, because we oftentimes have people who come in who've been to multiple doctors, multiple types of specialties, and haven't been able to be helped. And as they come in and they go through diagnosis and begin treatment, begin to have responses to care where their pain syndromes or their problems make remarkable improvement. And as a doctor, that is tremendously rewarding, because when you have the successful outcomes and you really want to help people, to hear them say that they're doing well and thank you so much is worth a tremendous amount, and it's fun. It makes practice fun. So I had an interesting case once, and this always excites me when I talk about chiropractic and what we can do. And she had come in, and we had done the history and the physical, and we had gotten a lot of thorough information from her, and she had had a chest wall problem, which wound up being a problem with her rib cage. Anyways, when she was being in the treatment room, she had turned over on the table, and she says, "Wait a minute." I said, "Well, what's wrong?" She goes, "Oh, it's just my vertigo." I said, "What do you mean vertigo? You never, I just interviewed you for a half hour, 45 minutes. You never told me about your vertigo." And she says, "Well, you can't help me." And I said, "Well, did you know that I'm also a neurologist?" And she says, "No." And I told her a little bit about the neurology program and the residency I'd done. And so she says, "Well, I still don't think you can help me, because I've been to Shands, and I've been to Mount Sinai, and I've been to Mayo Clinic, and they told me the only thing I can do to help with this vertigo is to take meclizine, or anti-dizziness medication. And I've been taking it every day for 30 years. And I says, "Well, let's get a little bit more information." And so as we went through the problem, and we went through the examination for that particular problem, we found out that she had a problem called benign positional vertigo, which is little calcium carbonate crystals in the ear, which cause people to feel like they're moving when they're not. And I treated her twice after making the diagnosis, and she's never had another bout of dizziness, room spinning, or vertigo since that time. And she gets off the table and she says, "Thank you." I says, I don't believe it, but it's gone. And when you get really excited about helping people, you have stories like that. And over the last 18 years of practice, it's those types of things that you look forward to when you come into work in the morning.